Good morning. I'm going to be explaining to you the primary priming of an IV tubing for the Plum. I am going to demonstrate both how to prime the tubing and how to put it on the pump. You're going to gather your supplies. For simple supply, you would need an IV that fits your order. You would have checked your order. In my case, the order has been for IV of normal saline at 75 mils per hour. I'm going to need Plum primary tubing set that goes with it. I will need labels for my IV tubing and for my bag. If it's a saline lock, I will need a flush to check verify patency. And I'm ready to go to my patient's room. I'm going to gather my supplies. Good morning, sir. My name is Nancy Huff. I'll be your nurse today. Your doctor has ordered for you to receive an IV fluid, and I'm going to establish that. Would you state your name and date of birth for me? I'm matching it to his armband, and I'm also pulling up my WOW, and I'm checking it against the WOW. That I'm looking at his MAR for an order. There is 75 mils per hour of normal saline, and that's verified. Are you allergic to any type of medications, chemicals, soaps, dyes, or tape? All right, no, good, thank you, sir. So I'm going to prepare my fluids for the IV pump. I'm going to do hand hygiene. I'm going to pull my bag. This will be my first check as I'm verifying it against my order. I'm going to open my bag, checking to ascertain its patency. If I had not already done a check, I could still do my check at this point as I'm hanging it on the IV pole, normal saline, and I know my order is normal saline. I'm going to use my tubing. Again, checking the patency. Instructions are on the bag. Typically, these will pull from the end. Taking out my tubing. First thing I'm always going to do is close my clamp. The tips that I want to protect are this tip that goes into the bag and the tip on the far end that goes into the patient. These are the two most important things to protect and maintain their sterility. My clamp is closed. I'm going to spike my bag after it. All right. I'm going to pull off the one from the bag first. Obviously, sometimes it takes some force. You don't want to contaminate your spike while pulling that off. I'm going to pinch my tubing, my drip chamber, line it up with a hole, and insert it in a twisting motion. Until it is in, covering the spike. Filling my drip chamber half full. I'm now ready to fill the cassette that comes on the Plum. This is your cassette that will go into the Plum machine. You have a boot or shoe. You have a dial, a regulator that you will rotate to get the flow. And you also have you have a big round disc at the bottom, and we're going to use that to know when to invert the tubing and when to have it right side up. Okay, so my tubing is clamped. My tubing I have filled up the drip chamber half full. I'm going to unclamp my tubing, put the boot or shoe to the floor. All right, so this one's going to be upside down to begin with. I'm going to unclamp it. It's not dripping, so I'm going to slowly regulate this knob by turning it counterclockwise. And it's, oops, a little too fast for me. Oh, there it comes, there's in my chamber. Now I'm going to right it, and it fills up the rest of my chamber, and it's pushing then all the air out ahead of it into my tubing. All right. And here it comes. If it doesn't want to run, you may need to loosen your cap just slightly on the tips of these, trying carefully not to take the cap off if at all possible. If there is a lot of air, you may need to run it out into a small cup. I know that it's coming. I want to open this loosely. It's still loosely connected. and it's slowly coming. I would rather run it slowly and have better control. I'm going to separate the cap because I don't want the cap tip wet. Alrighty, I've gotten my air out. I'm going to pinch my tube, and I'm going to put my sterile tip back on my patient tip. Alright, I'm going to close my clamp. Alright, after spiking it, I want to do another check to make sure I have the correct order, and I do. The normal saline. I know we're running at 75 mils an hour for Mr. Burke-Hevis. I'm now ready to put this into my machine. We have our primed tubing. We have checked it with our order on our MAR. We have primed it through the cassette to the end of our tubing, maintaining the sterility of the tips. If I have a saline lock, at this point I would check for patency. That would be using my saline flush, and I would check for patency, pull back to see if I have patency, and also to go ahead and inject it. We would label our tubing in our bag. This has the date and time so that we would know when changes would be necessary. Currently, most facilities give them 72 hours. CDC is now beginning to recommend 96 hours, and some of the facilities may already be going to that time. All right. We have established patency for my IV. I'm going to continue on. You have buttons to start, stop, on, off. Power on your machine. It will go through some self-checks. It tells you insert Plum set and close the lever. You'll take your Plum set with the white regulator to the back, slide it into the chamber, and when it says close the lever, this one that says close lever, and you push it down. If you needed to open it, you pull this one back up. Do not pull on this. This is the face of plate of the cassette. Pull on the one that says pull. Scroll down. My volume to be infused. I want enough there to alarm me with about an hour left to go, so I'm until at 4:25. Time, the duration for this running is appropriate. I'm going to connect it to my patient. In this case, you would have scrubbed the hub. I'm just going to show you the next step, which is to actually run it. So after you scrubbed the hub, hooked it to your patient, I'm going to press start. I should have A, pumping, B, stopped. My rate is 75 mils per hour. I stay and make sure that I actually see it dripping from my chamber. If it says proximal occlusion, you would go and check out what it's telling you, and in this case, it's because my clamp is closed. So I would open my clamp, would stop, make sure my rate is correct, 75 mils, and before I place start the third time, you need to make sure that you have done your third check before you tell it to start and run.